Heavy menstrual bleeding is a very common condition in women. There are various treatments that are employed. Medical treatment with non-hormonal preparations, or sometimes with hormonal preparations, particularly the pill, is commonly employed. The other, probably the more common treatment that's employed is a special coil that releases progesterone hormone locally in the lining of the womb and prevents the lining of the womb from thickening. However, if these do not work, and in particular if the family is completed, a woman is not seeking any more children, then as a more permanent or semi-permanent method, there are two other options. One is endometrial ablation, which is essentially burning or destroying the lining of the womb, or else a hysterectomy, which is generally done through keyhole, through laparoscopic surgery nowadays, which is to remove the womb itself. The womb, or the uterus, generally consists of two parts. The wall of the womb, the outer layer, is muscle and called myometrium. Inside the cavity of the womb, the cavity is lined by the lining of the womb called endometrium. This lining of the womb, or the endometrium, thickens every month under the influence of the hormone estrogen, and it thickens so as to accept a fertilized egg to hold a pregnancy. If in a particular menstrual cycle pregnancy does not happen, then this lining of the womb sheds as in a menstrual period. Therefore, in endometrial ablation, destroying or burning this lining of the womb is meant as a potentially permanent procedure to prevent having periods whatsoever, or at least having reduced periods, as in reduced lining. Previously, also called first generation endometrial ablation procedures, involved putting in a hysteroscope, which is a telescope, from below through the neck of the womb into the womb to have a look inside, take a biopsy if needed, if there are fibroids or polyps, to remove them at the same time using a little wire through which electricity passes and heats up to remove them, or sometimes laser to destroy the lining of the womb. These are called first generation ablation techniques, which are rarely used nowadays unless there are fibroids or polyps. The newer or second generation endometrial ablation techniques use either radio waves, microwaves, electricity, or heated water to destroy or burn the lining of the womb. In most cases, we do a hysteroscopy, so have a look inside the uterus with a telescope, take a biopsy before we do the procedure. These are considered safer, quicker, and more gentle on the patient with a quicker recovery. Many can be done under local anesthetic, even though many women still would prefer a general anesthetic for them. The procedure is always done as a day case, and women would go home at the most, even with a general anesthetic, within a couple of hours. One would expect some cramp-like pain, which may just need paracetamol for a few hours, very rarely for a day or so. Some blood-stained discharge is expected to continue up to a week. Very rarely a watery discharge can continue for 2 to 3 weeks. Infection is extremely rare and can cause lower abdominal pain, a little vaginal discharge, and in most cases goes away with a course of antibiotics. Extremely rarely more serious complications like perforation of the uterus or excess fluid overload may happen, even though they are more common with the older first generation techniques, which is not used as frequently nowadays. Most women are very satisfied with the endometrial ablation techniques. 10% of women would have no periods whatsoever. Another 70% would have reduced periods. In 10 to 20%, however, it may not work as well, particularly if the uterus is big, the cavity is big, most commonly due to fibroids, or it's a distorted cavity due to fibroids as well. Some women, particularly if those who have it earlier on, say around 40 years of age or less, may need a second procedure or a hysterectomy as a subsequent procedure after 5 years or so. Long-term complications as such are not known specifically. However, occasionally, particularly if there are bleeding later on in life, occasionally because the uterine cavity may be completely closed, taking a biopsy can be challenging at times. A more permanent method, however, is a hysterectomy. With endometrial ablation, following that, the chance of a pregnancy is very remote. However, we still suggest using contraception.